As a holistic health practitioner, you're on a mission to identify the root cause of disease and to do the detective work it takes to get people better. You're looking at your patients' or clients' diet, their movement, their exposure to heavy metals or chemicals, the air quality, the water quality, mold. But what about the electromagnetic or EMF environment? Dr. Dietrich Klinghardt, who's a health pioneer and medical director at the Sophia Health Institute, shared with me that there are two types of chronically ill patients that he sees: those who get better and those who don't. And you know the difference between these two is that those who get better follow his recommendations to reduce electrosmog exposure. In other words, if you're an MD, ND, acupuncturist, a DO, a chiropractor, health coach, or any type of healer who wants to get to the root cause of disease, if you're ignoring EMFs in your practice, you're probably missing a big piece of the healing puzzle. But first, let me introduce myself. I'm Nicolas Pineault, and I'm the author of the Non-Tinfoil Guide to EMFs. That's a book that's endorsed by dozens of health authorities worldwide, such as Dr. Joseph Mercola, Ben Greenfield, and Paul Chek. And in the last year alone, I've been featured on countless podcasts, summits, and offline media outlets, such as the Mindshare Summit and the Dr. Nandi Show. And since the release of my book, I've received feedback from hundreds of health practitioners throughout the world asking me the same exact question: Nick, how can I add EMF to my practice? How can I assess if my patients or clients are being overexposed to electrosmog? And I looked everywhere for a resource to recommend, but I realized that there's not one single holistic health conference, course, or program or certification that contains all the information health practitioners need to add EMFs to their current functional medicine practice. But the good news is that it was until now. I'm proud to introduce you to Electrosmog Rx, and that's the world's first EMF course for health practitioners. Electrosmog Rx contains the latest, cutting-edge, most concise, vetted information currently available in 2018 on how to EMFs fit in the functional medicine healing puzzle, and how to quickly translate what you learn in this course into better clinical outcomes. And to put this course together, here's what I did. I interviewed some of the world's most foremost health experts, including Dr. Dietrich Klinghardt, Dr. Joseph Mercola, and Dr. Ben Lynch, just to name a few. And then I also dug and summarized all the latest evidence-based recommendations from medical pioneers in the identification and mitigation of EMF-related problems, such as the Institute for Building Biology and Ecology, the work of Dominique Belpom from France on electrosensitivity, EHS, and also the European Academy for Environmental Medicine, and a lot more. Then what happened just in last February was something that I did not expect. We opened 300 seats to health practitioners for an exclusive live beta test of Electrosmog Rx, and the feedback was so amazing and the information so critical to practitioners that we've decided to make the recording of this entire course available to you right now on this very page by launching this self-study version. And so Electrosmog Rx self-study is a series of 5 content-packed pre-recorded webinar replays that are running for over 1 hour each, sometimes up to 2 hours, for 10 hours of EMF-related materials. The first webinar is EMF Basics. It's everything you need to know about our new electromagnetic or EMF environment. Then number 2 is Science, the credible data on how EMFs affect human health. Number 3, Symptomology, how to identify overexposure and sensitivity to EMFs. Number 4, Mitigation, evidence-based ways to reduce exposure to EMF. Number 5, Resilience, supplements, foods, and lifestyle interventions to alleviate EMF sensitivity. And each webinar included 30 to 45 minutes Q&A session, which is also included in a recording for, as I mentioned, more than 10 hours of EMF education without counting the bonuses. Because Electrosmog Rx includes both video, audio, and written version of these webinars, and the slides in a PDF format, but also there are bonuses included with it. There's a PDF copy of my latest book, The Non-Tinfoil Guide to EMFs, that is a great read, I think, to get introduced to the topic of EMFs, if I may say so myself. Several PDF cheat sheets that have been added based on practitioner feedback. One of them is an electrosmog questionnaire, which you can give to your patients and clients, and that has a detailed list of questions to better assess their overall exposure. Then it also includes the full interviews I've done with health pioneers such as Dr. Dietrich Klinghardt, Dr. Joseph Mercola, and Dr. Ben Lynch as I was putting this course together. And finally, something incredible, you're going to get access to the full course launching in late 2018 for a fraction of the price. What you pay today is less than $250, and yet you will get access to the full course that will be much more complete, and that will be worth at least $300, but people are telling me to price it at least at around $400, and that's free of charge. So you'll get access to future iterations of this beta as new interviews and new materials come available this year, also as a beta tester. And finally, there's also a private Facebook group that's available only to paid members of Electrosmog Rx, and I know the discussions and insights you will get in there from other health practitioners will blow your mind. It's incredible, and it's such a great collaborative platform to ask your questions and share your clinical observations. You know, Electrosmog Rx, it's cutting edge, and it contains clinical observations that are unpublished and that are pretty much impossible to find on Google or any book. It's critical information that will help you bridge the gaps between your patient's clients' symptoms, labs, questionnaires, and observations that might currently just not make sense. And you might just discover that the reason your patient or client isn't getting better is that they're sleeping with a cell phone under the pillow, like most people are these days, or even a Wi-Fi router that was mistakenly installed under the bed. That's very common. I see that all the time. So don't wait to take action and get your hands on this critical information. What I can promise you is that the sooner you learn about EMFs, the sooner you start realizing how much of a problem this is for your patient or client population. Thanks for watching, and have a great day.